Good morning. In the first video, we had a discussion on concepts, nature, characteristics of management, and we had a discussion on functions of management, the importance of nursing management, and we had a discussion on the principles and theories of management. So we have done with the two theories of management. I'll just give you the brief on theories of management. So we had a um, um, scientific theory, classical theory, bureaucratic, humanistic or neoclassical theory, behavior theory, motivational theory, leadership theory, and system theory. Out of this eight theories, we have done with the scientific theory and classical theory. Now we are moving on to the bureaucratic theory. Okay, so in this bureaucratic theory, according to Max Weber, we are strictly follow the rules and regulations laid down by the institution. Okay, so it is like strict rules and regulations to be followed, and it depends on line of authority and official capacity. According to the organizational structure, we have a different line of authority and then official structure, and that's to be followed. And it involves like a traditional authority, charismatic authority, legal rational authority. Let's see what is traditional authority. Traditionally, historically, we are following the few authority power and other thing, and that has to be the example like customs, it is there, so we have to follow it. That is one thing. The another aspect is charismatic authority. According to charisma, like we are feeling like they are like a hero heroines, and then we are following the same thing, so accordingly we would be following. So charismatic authority. And the next is legal rational authority. The people are no having everybody have got the right, so it is the rights of persons to be an authoritative person, and accordingly they would be doing a management, so it is a legal rational authority. Other than that, free contractual relationship, and this bureaucratic theory also believe on technical qualifications are necessary, and provision of fixed salary and right to promotion and pension. So all these things are already set rules and regulation and has to be followed. So this is about the bureaucratic theory of management according to Max Weber. Moving on to the next theory, it is like a humanistic theory, which is otherwise known as neoclassical theory. It is laid down by Elton Mayo. So here it is of like we are dealing with the human uh, manpower. So we have to little informal way, little flexible, should not be like very rigid, so that our social process and then people also would be involved in their work. So that is about the concept of humanistic theory. So according to Elton Mayo, it involves like attitude, the sentiment, feelings of the employee. So if the institution is towards the employee, certainly employee would be towards the institution. So it is of like an informal organization. They don't follow the very strict rules and regulations though, so it is of informal organization. They view organization as an emotional and social system since they are involving with the manpower. It emphasizes the sociological and psychological aspects of the organization, and it involves a democratic style of supervision. The previous one we have seen bureaucratic style, they should stick on to the rules and regulation. The other one we have seen authoritative, like a Hitler, whatever they say, we have to follow. Now it is like a democratic style of supervision. So here they give a provision for the decision making to the employee also. They take their own views also, employee view, and they'll come to a some consensual decision. So it focus on the social environment of the job. Wherever they are there, then they'll see the social environment. Assume the peoples are heterogeneous, so people are different, and then we need to know like we have people are unique in nature, so we have to like merge everybody together. We have to go with the people and then get the work done. So that is humanistic or neoclassical theory. The other theory is like a behavior theory. This behavior theory was given by Herbert Simon. It is also known as socio psychological approach. It is also known as socio psychological approach. Organization as the social system. And here, this also follow believes on scientific study of the human behavior in an organization. And if you see the organizational behavior, it could be like a informal relation. Yeah. So communication pattern can be changed and then little flexible. Motivations are very essential. Leadership is very important, and decision making, the right decision, and the power of the people, authority. All these things are influencing the organizational behavior. So based on the empirical methodology, human behavior can be studied and investigated objectively by application of universal law. So it could be like a field study and laboratory study. When people are working in an institution, and then when we are laying the rules and regulation policies, we have to give a preference to the people also. Why? How are they happy with the institution or the environment? How best they can be molded? It is concerned with the application of actual behavior of the people. It emphasizes more on the human relation and the informal communication in the organizational setting. This is the core of this theory. So it involves more of the human relations, maintain a good relation with the employee so that they would be towards the institutions. So it also involved with the informal communication in the organizational setting. The moving on to the next theory, like a motivational theory. So it based on the behavior induced by the manager by satisfying the individual needs and by motivational drives. So if we fulfill the, or how the manager could motivate the employees based on the thing, the management would be very effective. By knowing the need and the drive, the employee can be motivated for the organizational improvement. So we have to identify the need and drive of the employee so that we can fulfill, the organization can fulfill. That is how we can the employee would be motivated and they would be towards the institution more and more, and our works would be implemented. So this theory was proposed by uh, four people, six people. We'll see one by one. The first one is Maslow hierarchy of the need. So as we all knew, Maslow hierarchy need speaks about biophysiological need, safety and security, love and belonging, self-esteem, and self-actualization of the need of the individual at different hierarchical positions. So according to the needs of the people, all these different needs are there. If the institution employer is fulfilling all these needs, they would be they would be doing a better. The next is Herspech's motivational hygiene theory and job enrichment theory. So this he identified two job factor. So it could be a satisfier and dissatisfier. So these two things are involving the output of the employee. So this has to be rectified. That is the motto of this Herspech's. The first one is satisfier or motivation factor. So this determine the job satisfaction. How do they identify, or how do they have a good job satisfaction? It is like in terms of achievement and recognitions. If they have a good recognition, the responsibility, advancement and the growth, these things are like a satisfier or motivation factor. The second is dissatisfier or hygiene, which involves like determine the dissatisfaction at the work. We are trying to identify what make the employee no dissatisfied with their institution, and that has to be rectified. It may be like a working condition is not good, they are very rigid, or the policy administration is not good, and the salary and the other perks are not good. So that has to be identified. So these two factors, like either we are identifying the satisfier and then we are promoting, we are working on that. Another one is dissatisfier or hygiene, where we are trying to identify what make the good hygienic environment in the institution. The dissatisfier can be removed, and then that is how we are motivating the employee. The third motivational theorist is McGregor X and Y. McGregor X, it is also known as authoritative management. So McGregor X and Y. So theory X, it is also known as authoritative management. So employee are mostly lazy, dislikes and avoid the work. They need a direction and control and threat of job loss and the financial incentives to work hard. So here, usually the employees are very lazy and they don't want work. So here employer should take a initiation as a authoritative person, and that is how they would be getting a management, I mean, work done through it. The next is theory Y. Here it is like a participative management. Employees are more self-directional, and they are self-disciplined, self-controlled. They are committed to the work and the organizational towards the organizational goal. So here, just employer, the top level manager have to coordinate and get the thing. So it is like a participative management. It is not necessary the employer should be authoritative, like a theory X. It is just opposite to theory X. So it speaks on employees are very lazy in X, so that employer should take a upper hand. They must be authoritative. Whereas theory Y, they are all self-disciplined, self-control. They are towards the organization. So it has to be like a top level, and then the employee should be like a participative management. The next is theory Z. So theory Z is otherwise like a Japanese management style. So it involves combination of X and Y. Here also they are focusing much on how best we can keep our employee. Okay. So focusing on increasing the employee well-being and benefits by providing a freedom to work and the informal control. So that includes collective decision making, and we are ensuring the job security and focusing much on the employee and family welfare, and then so on the evaluation and the promotion activity, all such things. And same in motivational theory, we do have the other theorist like Adorfer's ERG theory. What is this ERG theory? So ERG, E, existence, R stands for relatedness, G stands for growth. It is actually the extension of Maslow hierarchy theory. Maslow hierarchy theory speaks on the need theory we have seen already. So here existence needs like Maslow hierarchy speaks on biophysiological need and the safety need. The same thing here, existence need, and the social and self-esteem, it is like a relatedness need, the same like love and belonging and self-esteem of Maslow hierarchy here is put up as a word of relatedness theory, since we are dealing with the other people, love and belonging, and they must be given the self-respect, so self-esteem would be ensured. The last one is growth need theory, so which speaks on the self-actualization. It is of like we are like it can be like example pension scheme we are introducing, so that they would be doing a best, no, they need not to be worried. So they'll be more loyal to the institution. So this is of Adolphus ERG theory, existence, relatedness, and growth need. It is an extension of Maslow hierarchy theory. The next is David McClelland three need theory. It is otherwise known as achievement motivational theory. So here the need for achievement, when organization is there, we have to facilitate for their professional and personal growth, achievement. Need of the power, we have to give them a power and authority. The need for the affiliation, we have to acknowledge them that yes, they have done the wonderful work, so that people would be working in the better way. Okay, so that is how we have done with the motivational theory. Moving on to the leadership theory. So here we are having great men trait theory, behavioral leadership, situational leadership, Redin's theory. So let's see one by one. Great men and a trait theory. Great man and a trait. From the name, we could make it out. The leaders are inborn, okay, inherited characteristics of leaders, or traits suited to the leader. So they are all inborn leaders, so that they could do in the better way. So that is how they would be managing. So that is of great man or trait theory. The next is behavioral leadership theory. So this speaks about the democratic, autocratic, and laissez-faire. The democratic leader involves the fellows in a decision making. We are taking the the employee's vision also, employee's decision also inculcated. So we are like a participative decision making. We are giving a equal chance to the employee, so that we are taking a decisions, though they also will feel comfortable. So that is how we are managing the institution. So that is democratic, by using the democratic leadership skill. Autocratic, their employer would be making their own decision, and that has to be followed by everyone. So that is the another management style. Laissez-faire, here the top level person will not take anything. They are least bothered about the thing. So employee, the lower level people would be taking much of the decision, and then they would be doing a management. So that is of behavioral leadership theory: democratic, autocratic, and laissez-faire. The third is situational leadership theory. So because of this, the leader will be there and that leader will be managing the institution. So situation or environment is influencing the leader. Charismatic, as we have discussed in the other slide. So they would be like, no, like they are my hero or heroine. So the because I like some character and that is persists with that people, and then they would be like a leader, and then those people, I mean, and we are employing them and acknowledging them as a leader, and they would be doing a management. Another one is national leader does not seek on the role. They may not much focus on the role, but still we have a national reputation, so that is how we are respecting them, and then management is going on. Whatever they say, we will do it. Rational leader, they are very consistent and persistent in nature. For each and everything, they are like rationalizing. They are coming out with the justification. So that is how they are accepted as the leader, and then that is how they are managing the institution. Consensus leader, it is perceived as acceptable to all. All the employees are accepting, yes, he's good, and then he will do the wonderful. So that is consensus leader. And the leader by force here, the superior would be showing the like a threat to the other people. That is how everybody would be bowing down and then listening to him or her. So that is how they would be managing the institution. So it is leader by force. The fourth leadership theory theorist speaks on three-dimensional leadership. So Reddin's three-dimensional leadership, three factors such as task, the relationship, and then behavior of the leader would be plotted on the x and then y axis. And according to that, they are categorizing into four types of leader. One is dedicated leader, integrated leader, separated leader, and related leader. Let's see what is dedicated leader. Dedicated leader perform high task. They would be doing high task and low relationship with the subordinate. So they are focused much on the institutional development. That is, dedicated leader does it. Integrated leader, they would be doing both the things in a mixed manner. They will balance both the things. High task, high relation. That is integrated leader. The separated leader, they will do less task and less relationship. So what happened with the subordinate? So it is separated leader. The related leaders, low task and high relation, they would be with the subordinate. So according to Reddit, there are two things, that is task and then relationship, and it can be plotted in the x-axis and y-axis, and accordingly the leader can be decided, and then accordingly they would be managing the institution. Dedicated, integrated, separated, and related leader. The last theory speaks on the system. System is like organization as a system. The first person speaks on the institution as the system is Chester Bernard. So system is a set of arrangement of things so related or connected to form a unity of organic whole. It consists of input, process, and output, feedback, and environment. So according to Chester Bernard, as I have told, he is the first person to mention organization as a system. It is a cooperative social system. There are so many subsystems are available. So it is an open system which is influenced by the changes in the environment. Whatever changes in the environment, that is going to have an impact on the organization. So the it is environment is dynamic always, and the organization is going hand in hand with the balancing or equalizing this balance. Okay, dynamic equilibrium or homeostasis. So dynamic process of interaction in the organization, it keeps change. Earlier, what practice we had, now we are not. So we are keep changing with the environment, because we are all now techie savvy. So even our teaching system has been improvised. We are going hand in hand with the current changing environment, because the society is dynamic in nature. People in positive sense and human motivations by how are they motivating a human being? By monetary benefit, social and psychological factors, which is more no like a thing, focusing on the very flexible participative structure of the organization. Everybody should be given an equal chance to speak it out, and the better things can be taken out. Emphasize all the dimensions of the organization. The organization means there are different dimensions, all have to work together. So the dimensions in terms of subsystem, he was explaining. What are the subsystem? If we take one organization, we have different, excuse me, different departments like technical subsystem. So technical subsystem speaks on the mechanical process, how best we can get it done. The next is supportive subsystem. It is the organizational activities and maintenance of the subsystem. that is of input of human skills. Adaptive subsystem, how best we are planning as per the environmental changes. Psychosocial subsystem, because we are dealing with the human, so human relation and human behavior. Structural subsystem, job and then position, how much vacancy we have, whether we are fulfilling or what. Management subsystem, coordination for internal and external relation with the environment. So if you see, these are all some subsystem. If all the subsystems are working properly as a system, the organization also would be working in a better way. So that is about system theory. Okay, till now we had a discussion on the management. Moving on to the nursing management. So if you see the definition, it is the process by which the nurse manager work through the others and to achieve the organizational goal of the nursing department. So when we are working with the people and achieving the nursing organizational goal, this is called as nursing management. And system of activities which is directed towards nursing care of patients. Ultimately, who is the core of nursing? It is the patient. So how best we are working towards providing a quality care to the patient is called as nursing management. If you see the comparison between the nursing process and the nursing management, in the nursing process we are doing the assessment. In the nursing management we are trying to collect the data so that that would be helping for the identifying the best way of working environment in the institution, data gathering. In the nursing process we are working on the diagnosis, and here we are doing a planning activity, and here also we are doing a planning. So in management we are doing how we can organize the activities. Here implementation, there it is like a leading or directing. Here it is the evaluation, whereas in the nursing management it is like a controlling. So these are all the comparisons between process and the management. Do we need a nursing management? Do we need management in nursing? Obviously. Why? To make a basic frame for the scope of nursing. Because if you see the nursing scope, it is like education, administration, research, and nowadays nursing informatics. Wherever we does it, management is very, very essential because it is the base. Okay, so to make a basic frame, to be an instrument for executing the law, policies, and the programs, to execute the rules and regulations, to the policies and programs, we need the nursing management. To be an instrument for social change and the professional development in nursing, because whatever we have seen, no, the like management have to go hand in hand with the society need, because it is dynamic. So accordingly, to bring out with the best thing, if you take an example, the scope of nursing management in education. So we are not bounded with only blackboard method. We are coming up with the tele conferencing, and we are coming with the virtual learning. Many things have come. So to be an instrument for social change and the professional development in the nursing, we need management to integrate the nursing education and transform the nursing care. Even if we take a electronic health recording, even for the nursing care, so we have to see what are the best available things, how best I can manage the patient. So for that we need a nursing management. To preserve the policies, we need a nursing management, because with this we have seen like a planning. From there we are starting to maintain the stability and order of the nursing organization we need, because until unless we learn about the post guard, it is quite difficult to run the institution or run the ward effectively. To manage the nursing personnel, because we have seen a different styles of or theories of management. If we learn, we know how to tackle the patient or how to tackle the manpower, whomsoever is a superior, subordinate, and then my colleague. To institutionalize the socio-economic changes and prepare the nurses for the future. To ensure the growth and development of the nursing profession, we need a management in nursing. To protect the legal and ethical rights of the nursing in the society, we need, because we have seen management is a profession we have seen already. If you see the qualities of a nurse manager, of course, the nurse manager should possess the technical skill, that is professional knowledge. She should have a good knowledge. She must be having a good physical health, then only she can take care of the patient. And she should have a commanding power so that she can do a better administration. She need to have a conceptualized skill, ability to understand quick decision, she have to take it, because she is dealing with the patient life, and the ability to judge the situation. The patient is suddenly collapsed, and what has to be done immediately. So there how she would be taking the immediate judgment, ability to judge the situation. She should have a good willpower. At times she have to work alone, at times she have to work with a unique people. She should be very strength as a mental uh, for the mental health and other thing. Sense of responsibility should be good, experience, and then enthusiasm. It is very, these are all she must be very innovative, creative, motivate the people. These are all the qualities of the nurse manager. The role of nurse manager can be planned. We are not discussing about nursing officer who is giving immediate care. We are discussing about role of nurse manager for providing a quality care to the patient, right? So here she have to coordinate with the many people, different department for the quality care to the patient. So in terms of like a planning, organizing, staffing, directing, coordinating, reporting, and then budgeting, planning for the ward. Maybe she is in charge of the 2 3 wards, how she have to plan it, and how is going to coordinate with the other department, how she is going to organize the work, how she is going to meet the need faculty requirement or the staff requirement. After recruiting, how are they going to be directed or laid for the thing, how we are coordinating with the other department, to whom she have to report it, how she have to report it, and for the effective management of the unit, what and all she need in terms of budgeting. All these things can be done as a role of nurse manager. Other than that, towards the employer, she must be very loyal and honest, and then have a clear channel of communication, and she should suggest for the feedback, and then principles of the policies can be made for the particular ward. And towards the government, whatever the management or the government schemes are available, that must be given to the patient. And towards the senior and colleagues, and then subordinates, she have to she have to have a good communication skill. She should always think about the quality comprehensive patient care. So how best she can coordinate with the other departments so that this need can be fulfilled. And towards the profession, she should be very loyal. She should always see that the dynamic nature of the things, and then the professional growth, how best she can work out, and then best evidence practice to the patient. And towards the consumer, ultimately the recipient is the patient. So how best she can provide a care to the patient. And then towards the economic policy, whatever available resources she have to utilize for the betterment of the unit. And then there must be a good significant nursing care to the society even. So in general, if you see, preparing the objectives, patient assignment, delegation of the duty, supervising the subordinates, and then care whatever she has given, supervising the patient, coordinating with the other department, interdisciplinary approach, multidisciplinary approach, program evaluations, which includes performance appraisal of her subordinates or peer evaluation, and record and report keeping is in the better way of what, auditing to identify whether we are giving a quality care, cooperating with the other department, maintaining a good public relations so that the smooth functioning can be taking place, and being a good advisor for the subordinates, and then wherever it is essential to the higher management for the smooth functioning. Budgeting, the financial thing should be forecast, and there should be control, inventory control, everything to be planned properly. Staff development is very essential because the society is dynamic in nature. According to the need of the society, we also should go hand in hand. So staff development should be planned and should be deputed, uh, and then thereby they would be giving a quality care to the patient. So with this, we have done with the first unit. To summarize, we have seen about the meaning, concepts, definition, nature or the characteristics, principles of management, difference between administration and management, scope of management, elements and functions of management, and theories of management, definition of nursing management, and application of management theories in nursing, and role of nurse as a nurse management manager. So this is what we have discussed. To conclude, nursing is a profession with mixed skills. We need to deal with the various department. Ultimately, our goal should be like the better care to the patient, and so that they should have a sound knowledge on the management for the smooth functioning of an organization. Nurses are the one who takes much of the responsibility of the client care, because they are the immediate care provider. So they should have possess all this good management skills, and a nurse educator for the student, as an administrator for the organization, as a researcher for the consumers. So we have a different scope of nursing. Hence, she must abreast with the management knowledge and competency in execution of the activities. Okay, so these are all the reference which I have taken. And these are all the few multiple choice questions which I have prepared. Short essay, long essay, and this is the game-based learning which I have prepared. The link will be shared in the classes. Thank you so much for your listening. Thank you. Hope this session would be helping you to understand the Unit 1. Thank you all.